been struggling with back pain for quite some time, the chances are you've visited either a physiotherapist, an osteopath, or a chiropractor. There's lots of overlap in these treatments, but I broadly divide them into passive therapy, so manual therapy, or active therapy, which is exercise therapy. Well, which works best? My name's Anthony Ghosh, I'm a consultant spinal neurosurgeon and director of the Spine MDT, and in this video I'm going to discuss some recent evidence that demonstrates that active or exercise therapy is the clear winner. Firstly, let's go over some of the definitions. So by passive therapy, we mean where the therapist does the work and not the patient. So things like manipulations or adjustments, massages, acupuncture, depending on who you see. And by active therapy, I mean where you, the patient, does the work, but the therapist guides you through it and educates you. He's specifically been taught and guided through a set of exercises, and then upgrading the standard or resistance of those exercises over time and watching your progress. This study was only published this year in the Journal of Orthopedics and Traumatology. It was carried out by colleagues in the United Kingdom, Germany, and Italy. And they went through all of the research published to date on physiotherapy for back pain. So this is over 2,000 papers, but then they narrowed them down into the high quality studies that have a high level of evidence, so randomized controlled trials. And the findings were quite clear. Exercise therapy is the clear winner. It beats passive therapy, but not only that, it even beats a combination of exercise and manual therapy. Exercise therapy improves and retrains your muscles in handling load around the spine. It improves your range of motion and the fluidity of your movements. More importantly though, it does encourage self-management and self-rehabilitation and just becoming generally more independent. He also highlighted a correlation, a link between shrinking or wasting of the muscles that support the spine and chronic pain, reinforcing the importance of having better, well-conditioned muscles that support the spine, outlined here in red. What the research has shown, however, regarding manual therapy or passive therapy is that it can give you short-term improvement in your range of motion and pain that can then allow you to engage in exercise, which is the main therapy. So this can be useful as a starting point if you have any beliefs regarding the cause of your back pain or abnormal beliefs that need addressing regarding to any damage exercise may be doing, and that was addressed in this study. The importance about addressing any beliefs of the causes of your back pain and clarifying them has been extensively researched by Professor Peter O'Sullivan of physiotherapy in Australia, and there's a link to my interview with him below. His field is cognitive functional therapy, which has been proven to be exceptionally beneficial in people with chronic lower back pain. Something that frustrates me is that I often hear patients tell me they've been seeing their chiropractor or other therapist for about 15 years or so. Well, that simply tells me that the treatments they've been getting, which is often passive therapy, i.e. manual therapy, adjustments, manipulations, is clearly not working, and you're becoming dependent on visiting these therapists for these treatments. The goal of treatment should be to eventually make you independent and manage your own pain, or hopefully not need any treatment for it. So our practice at the Spine MDT is to firstly rule out a pathological cause of back pain. I personally hate the phrase non-specific back pain. There's no such thing. What we mean is pathological versus non-pathological, i.e. is there a finding on your MRI scan that correlates with the history and examination findings by a good clinician? If there isn't, that doesn't mean it's non-specific. There usually is an underlying mechanism, and it's our role to try and identify that mechanism with a team approach, i.e. both the clinician, i.e. the surgeon that's seeing you, but also the physiotherapist, osteopath and chiropractor, and then have a definitive management plan, which should often be exercise therapy. Manual therapy does have its place, i.e. it can give you short-term relief to then get you into the exercise therapy, but then it's about doing the right exercises, but also retraining you to do normal day-to-day functional movements, eliminating any false protective behaviours that you may be adopting that you think are helping but are actually making things worse. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you very much for watching.